Have you ever wondered why we spend a third of our lives sleeping? It's a question that's puzzled scientists and philosophers for centuries and continues to intrigue us today. Sleep, an activity so commonplace, yet so shrouded in mystery. Let's start with the basics. We all know sleep is crucial, but why? Well, it's a bit like hitting the reset button. Our bodies and minds need this downtime to rejuvenate and repair, to process the day's experiences, and to prepare for the challenges of tomorrow. It's during sleep that our bodies grow muscle, repair tissue, synthesize hormones, and perform a host of other vital functions. But what exactly happens when we close our eyes and drift off into the land of dreams? Sleep isn't just a single state. It's a complex series of stages, each with its own unique characteristics and functions. From the light drowsiness of stage 1 to the deep, restorative slumber of stage 4, and the vivid dreams of REM sleep, our nightly journeys are a remarkable blend of rest and activity. But what happens when our sleep is disrupted? We've all experienced the grogginess of a sleepless night. But for some people, sleep disturbances are a regular occurrence. Insomnia, sleep apnea, narcolepsy, these are just a few of the many sleep disorders that can rob us of our rest and wreak havoc on our daily lives. And then, there's our biological clock, the internal timekeeper that governs our sleep-wake cycle. This clock is regulated by light and darkness, and it has a profound influence on when we feel alert and when we feel sleepy. But what happens when our biological clock gets out of sync? These are just a few of the questions we'll be exploring as we delve into the fascinating world of sleep. From the science behind our nightly slumber to the impact of sleep on our health, learning, and memory, we'll be uncovering the mysteries and marvels of this essential aspect of our lives. Stay tuned as we delve into the fascinating world of sleep. Sleep isn't just a single phase, but a complex series of stages. But what exactly happens when we drift off? Well, sleep is a fascinating journey that your body and mind embark on every night, and it's divided into 4 distinct stages: N1, N2, N3, and REM, each with its unique characteristics and importance. Let's start with the first stage, N1. This is the initial stage of sleep that serves as a transition from wakefulness to sleep. It's a light sleep stage where you may feel as if you're floating or falling. Your heartbeat, breathing, and eye movements slow down, and your muscles relax with occasional twitches. It's a brief stage, typically lasting just a few minutes. Then, we transition into the second stage, N2. This is when you start to become less aware of your surroundings, and your body temperature drops as you prepare for deep sleep. Your brain waves become slower with only occasional bursts of rapid waves, known as sleep spindles. This stage represents the largest portion of your sleep cycle, accounting for about half of your total sleep. Next comes the third stage, N3, also known as deep sleep or slow wave sleep. During this stage, your brain waves are extremely slow, interspersed with smaller, faster waves. It's the stage that is crucial for feeling refreshed in the morning. It's also when some extraordinary things happen, like tissue growth, cell repair, and the release of hormones crucial for growth and development. Finally, we arrive at the most intriguing stage, REM sleep, which stands for rapid eye movement. Here, your brain becomes more active, almost similar to when you're awake. This is the stage where most dreams occur, and your eyes move rapidly in different directions. Your breathing becomes faster and irregular, and your heart rate and blood pressure increase. Interestingly, your arm and leg muscles become temporarily paralyzed, preventing you from acting out your dreams. These 4 stages together make up a single sleep cycle, which lasts about 90 to 110 minutes. And guess what? This cycle repeats itself multiple times throughout the night, usually 4 to 5 times, allowing you to drift between different stages of sleep. Now, you might be wondering, why all these stages? Why not just a single stage of deep sleep? The answer is that each stage of sleep plays a unique role in maintaining our physical and mental health. For instance, deep sleep helps with physical recovery, while REM sleep is associated with memory consolidation and mood regulation. So the next time you wake up feeling refreshed, you know you've been on a journey through these stages. Have you ever noticed how you naturally feel sleepy or awake at certain times? It's not random. It's your biological clock ticking. Imagine an orchestra where each instrument plays its part in harmony. In a similar way, our bodies function in a rhythmic pattern, orchestrated by our biological clock, also known as the circadian rhythm. This rhythm is not just about sleep and wakefulness. It influences a myriad of bodily functions, including hormone release, eating habits, and body temperature. At the helm of this rhythm is a tiny part of our brain called the suprachiasmatic nucleus, or SCN for short, located in the hypothalamus. It's like the conductor of our body's orchestra, keeping everything in sync. It receives light information from our eyes and uses this to reset our clock every day, ensuring that we are tuned in to the world around us. Our SCN controls the production of melatonin, a hormone that makes us feel sleepy. When it's dark, more melatonin is produced, and we start to feel drowsy. Conversely, when it's light, melatonin production decreases, and we feel more awake. This is why, despite all the technological advancements, our bodies are still attuned to the rising and setting of the sun. But our biological clock doesn't work in isolation. It's influenced by various factors, such as our lifestyle, age, and even our diet. For instance, teenagers often experience a shift in their circadian rhythm, which makes them stay up late and sleep in. This is not just a rebellious phase, but a biological change that occurs during adolescence. Disruptions in our biological clock can lead to various health problems like insomnia, depression, and even certain types of cancer. It's why jet lag can feel so disorienting, as our bodies struggle to adjust to a new time zone. So, it's important to maintain a regular sleep schedule and to make our environments conducive for sleep, such as keeping our bedrooms dark at night and bright in the morning. This helps our biological clock stay in sync, and our bodies function at their optimal best. Indeed, we are more than just creatures of habit. We are creatures of rhythm. Ever had a night when sleep just wouldn't come, or when nightmares wouldn't let you rest? You're not alone. Today we delve into the world of sleep disorders, those pesky interruptions of slumber that can turn a good night's rest into a battle of wills. Let's start with one of the most common sleep disorders, insomnia. Insomnia, in its simplest form, is the inability to fall asleep or stay asleep. It's like being stuck in a twisted version of Goldilocks and the Three Bears, where the bed is never just right. Insomniacs may lay awake for hours, their minds racing, or they may wake up multiple times during the night. The cause, stress, anxiety, and depression are often culprits. But don't lose hope. Treatments are available, ranging from improving sleep hygiene, cognitive behavioral therapy, to medication. Next, let's talk about sleep apnea, a disorder that's as tricky to pronounce as it is to diagnose. Sleep apnea is characterized by pauses in breathing or instances of shallow or infrequent breathing during sleep. Imagine trying to sleep while someone intermittently holds a pillow over your face. Not pleasant, right? These disruptions can lead to daytime sleepiness and a host of other health issues. The causes can be physical in nature, like having a large tongue or tonsils or being overweight. Treatments can include lifestyle changes, use of a breathing device at night, or even surgery in severe cases. Now imagine feeling an irresistible urge to sleep in the middle of the day, even if you had a full night's sleep. Welcome to the world of narcolepsy. This neurological disorder affects the brain's ability to control sleep-wake cycles. So, people with narcolepsy can feel excessively sleepy during the day or experience sleep attacks, where they fall asleep without warning. The cause? It's often linked to a lack of hypocretin, a chemical in the brain that regulates wakefulness. While there's no cure, medications and lifestyle changes can help manage the symptoms. Last but not least, we have restless legs syndrome, or RLS. This is a condition where you have an overwhelming urge to move your legs, often accompanied by uncomfortable sensations. It's like your legs have their own dance party, but forgot to invite the rest of your body. These symptoms often occur in the evening or at night when you're sitting or lying down. The cause? Sometimes it's hereditary. Other times it's linked to certain medical conditions or medications. Treatment often involves identifying and managing the underlying condition, medication, and lifestyle changes. Recognizing these disorders is the first step towards getting a good night's sleep. So, if you're struggling with sleep, it might be more than just a bad day or a lumpy mattress. Reach out to a healthcare professional and start the journey towards better sleep and better health. After all, everyone deserves a good night's sleep. We all know sleep is important, but just how does it impact our health? Now, this is a question that merits a substantial exploration. Sleep is not just a passive state where we switch off from the world. It's a dynamic process where our bodies and minds undergo significant restoration and rejuvenation. Let's start with physical health. During sleep, our bodies are busy repairing muscle, synthesizing proteins, and regenerating cells. This is why, when we're unwell or injured, we instinctively crave more sleep. Our bodies are demanding the downtime they need to heal. But it's not only about physical recovery. Sleep plays a crucial role in maintaining our metabolic health as well. It helps regulate hormones that control appetite and the way our bodies process glucose. Ever wondered why you feel ravenous after a night of poor sleep? That's your hormones out of whack, my friends. Now let's delve into the brain. One of sleep's most vital functions is memory consolidation. While we're catching those Z's, our brains are busy processing the day's experiences, converting short-term memories into long-term ones. It's like the brain's own version of housekeeping, tidying up and making room for the new day's data. But the brain doesn't stop at memory. Sleep also plays a critical role in regulating our mood. Ever noticed how things seem bleaker when you're tired? Sleep deprivation can lead to mood swings, anxiety, and even depression. Good sleep, on the other hand, can boost your mood, reduce stress, and improve your overall emotional well-being. However, like most things in life, it's all about balance. Too little sleep, and we've covered what happens. But too much sleep can also be problematic, linked to conditions like heart disease, diabetes, and increased mortality. Chronic sleep deprivation is a serious issue. It's not just about feeling grouchy or being in a bad mood. Over time, it can lead to significant health problems, including obesity, diabetes, cardiovascular disease, and even some cancers. It weakens our immune system, making us more susceptible to infections. It can also accelerate the aging process. So, if you're tempted to burn the midnight oil, remember this: sleep is not a luxury. It's a fundamental pillar of health. It's as important as eating well and exercising regularly. And just like nutrition and physical activity, the quality of your sleep matters as much as the quantity. In our fast-paced, always-on society, sleep is often the first thing we sacrifice. But by doing so, we're not just robbing ourselves of rest, we're compromising our health, our well-being, and our quality of life. Clearly, a good night's sleep is more than just a luxury. It's a necessity for our well-being. And with that thought, let's tuck in for a good night's rest and wake up to a healthier, happier, more vibrant you. Did you know that sleep does more than just rest our bodies? It also sharpens our minds. Let's delve into the fascinating world of sleep and its profound impact on learning and memory. While we're snoozing, our brain is bustling with activity, processing the day's information and preparing for the next. It's during this time that our brain consolidates memories, solidifying them from fleeting thoughts into long-term recollections. If you've ever pulled an all-nighter only to find your recall hazy the next day, you've experienced the impact of sleep deprivation on memory firsthand. But it's not just about remembering facts and figures. Sleep also plays a pivotal role in learning. It enhances our cognitive abilities, helping us to absorb new information more effectively. Remember, a well-rested mind is a receptive mind. So, if you're trying to master a new language or skill, ensuring you get a good night's rest could be the secret to success. Think about sleep as a productivity tool. It's during the deep stages of sleep that our brain sorts and stores information. It's like a night shift librarian, carefully cataloging the day's events. This process is essential for problem-solving and creativity. A rested brain is more likely to make connections between disparate ideas, sparking those aha moments of insight and innovation. If you're skeptical, consider this. Numerous studies have shown that people who sleep after learning a new task perform better on tests the next day. This is true whether you're learning to play a musical instrument, mastering a new sport, or cramming for an exam. It seems that sleeping on it really does help. But remember, it's not just about quantity, but quality of sleep. A disturbed or restless night can be just as detrimental to learning and memory as a lack of sleep. So, it's crucial to prioritize good sleep hygiene for optimal cognitive function. So, if you're studying for an exam or learning a new skill, don't forget to sleep on it. Now that we understand the science of sleep, how can we use this knowledge to sleep better? Sleep, as we've discovered, is a complex and vital process. But fear not, there are practical and effective ways to harness this process for better sleep hygiene. Firstly, maintaining a consistent sleep schedule is crucial. Your body's internal clock or circadian rhythm thrives on consistency. Try to go to bed and wake up at the same time every day, even on weekends. This regularity can significantly improve the quality of your sleep. Secondly, create a restful environment. Your bedroom should be a sanctuary dedicated to sleep. Keep it dark, quiet, and cool. Consider using earplugs or a white noise machine if you're dealing with unwanted noise. A comfortable mattress and pillows can also make a world of difference. Thirdly, what you eat and drink matters. Try to avoid large meals, caffeine, and alcohol close to bedtime. These can disrupt your sleep cycle and lead to poor sleep quality. Instead, opt for light, sleep-promoting foods and drinks in the evening, like chamomile tea or a small turkey sandwich. Next, let's talk about electronics. The blue light emitted by phones, tablets, computers, and TVs can interfere with your sleep. It's best to turn these devices off at least an hour before bedtime. Instead, consider reading a book or listening to calming music to help your mind wind down. Exercise is another key component. Regular physical activity can help you fall asleep faster and enjoy deeper sleep. However, try not to exercise close to bedtime, as it might leave you too energized to fall asleep. Lastly, managing stress and anxiety is essential for good sleep. Consider incorporating relaxation techniques into your routine, like yoga, meditation, or deep breathing exercises. These can help prepare your mind for a restful night. With these tips in mind, you're on your way to a better night's sleep. Remember, good sleep isn't just about quantity, it's about quality. Your body and mind will thank you for it. Sleep tight. We've journeyed through the science of sleep, and what a journey it has been. We've explored the captivating mystery of sleep, tracing its stages from the lightest slumber to the deepest dream-filled abyss. We've delved into the inner workings of our biological clock, learning how it synchronizes our sleep-wake cycle with the 24-hour day, and how it can be thrown off balance, leading to sleep disorders. We've discovered how these disorders, from insomnia to sleep apnea, can disrupt our nights and impact our days. But we've also learned that these conditions are not insurmountable, and with the right understanding and approach, we can work towards better sleep. We've looked at how sleep affects our health, touching on everything from our immune system to mental well-being. We've seen how vital a good night's sleep is to our overall health, and how chronic sleep deprivation can have serious repercussions. It's clear that sleep isn't a luxury, it's a necessity. We've also dived into the critical role sleep plays in learning and memory. It's not just about recharging our batteries, but also about consolidating new information and skills. When we sleep, our brains are busy sorting and storing the day's experiences, helping us remember and learn. Finally, we've shared some practical tips for better sleep. From maintaining a regular sleep schedule to creating a sleep-friendly environment, these strategies can help us make the most of our nights and days. In conclusion, understanding the science of sleep is not just about satisfying our curiosity, it's about improving our lives. By appreciating the complexity and importance of sleep, we can better care for ourselves and those around us. We can sleep better, live better, and learn better. Remember, every good day starts with a good night's sleep. Sweet dreams.